My name is Seda Gürses. I'm a professor in the Faculty of Technology, Policy and Management in the group called Multi-Actor Systems. My work is predominantly on engineering systems with respect to privacy, but also other values. So I'm a computer scientist, and I've been working on what is called privacy enhancing technologies, which are technologies that design privacy protections into the systems. And as part of that work, I started working with developers and looking at the production of software, and realized that it poses great challenges to do privacy enhancing technologies. And in the process of studying that, I noticed that I have to study how the software industry has changed over the last 20, 30 years. So I study what I call computational infrastructure. So how is software developed? What is the political economy of it? How does it come to be delivered? And what are the infrastructures that make that delivery possible? And as a result of that, I noticed that optimization is an important part of how we produce software, both optimization of production, but also optimization using machine learning and AI. And so in the gist of privacy enhancing technologies, which provide you ways to protect your privacy using technology, for example, secure messaging with WhatsApp or Signal, or Tor, which allows you to anonymously surf the web, we have now been developing protective optimization technology. So if the world around us is managed by software that's trying to optimize our livelihood, is there a way to resist or protect ourselves with technology? So that's what I work on. So I think it's, we need to first take a step back. I think we're in this very particular situation where many of us are at home, some of us are outside delivering care or services, and we're in a lockdown despite all of this, even though there are some people outside delivering care. And we're told now that we have to either accept surveillance of some sort or we have to stay in lockdown. First of all, I would like to say that this is a false dichotomy. I think there are many ways to leave our homes, and there are many places where people have done, let's say, post-pandemic, maybe not, but post-epidemic unlocking of societies without saying you have to be under surveillance all the time. Having said that, I think there have been calls for very specific applications and very general applications. I will talk about both of them. The more general applications is, I would say, like using the COVID-19 crisis as an opportunity, especially by business, but sometimes in collaboration with governments, to grab as much data as possible and to privatize services to software companies or companies that are in the business of building digital services. And those are not the ones I'm going to talk about, although they should be of great concern to us, because all of this is being done behind closed doors without democratic discussion and with serious implications, not just for privacy, but also what kind of health services are delivered to us and under what conditions, or what government services will be available to us, but also how populations will be managed and how much a say private companies will have on public governance of populations and their livelihoods. That's also including education. So amidst all of this run, right, like anywhere from, you know, McKinsey and Accenture and Capgemini and Palantir, which is actually a company with a very bad reputation for human rights violation, now offering governments to take over health services and make them more efficient in light of the pandemic. We have also been tasked with a very specific application, which is the contact tracing applications. And the call for contact tracing applications is combined with this idea that we usually have contact tracing manually, and currently many governments are hiring thousands of people to do this. And the idea is that maybe we could make this contact tracing more efficient by adding on an application that would kind of log who we have seen over the days. And if one of us is ill, let's say I'm ill, and I go to a health authority to get tested, and I test positive, then I can show this log or use this log to inform people who I've been in touch with in the few days before I had started showing symptoms, so that they can be informed and either go get tested or consider self-quarantine. So the potential of these apps is in making contact tracing more efficient, And as a result, I think there are a couple of aims for making contact tracing more efficient. One is to, I think the hopeful one, and I would argue that we don't know if they will work this way, but the hopeful one is that if we can kind of quickly notice when people have gotten infected with the virus and inform others who they've been in touch with or in their proximity of, then we can avoid a complete lockdown as we have now. I think that's a wishful thinking. We don't know if that will work. The maybe more modest idea is that we can be more efficient in testing people and taking care of them. And some of that, I think, is also coming with the hopes that maybe epidemiologists can use some of this data to understand better how this disease is moving and how it's affecting us. But from both computer science and privacy perspective, I would say that's a different application, and that's kind of a double use of contact tracing apps. And there, I think, come a lot of the risks of contact tracing apps. I mean, number one is that we can now build an application that is very, very specific, but once it's deployed, people might continue to add functionality over it, which would increase its data collection power and therefore its misuse and abuse, both by governments, health authorities, or companies. The other problem is that by virtue of being an app, it basically pools the whole computational infrastructure that is currently being dominated by a few companies. And by that, I'm specifically referring to Google and Apple, but I wouldn't limit myself to that. I would say, Amazon is a pretty big player and Microsoft is a big player in this space too. So as soon as you think about an app that's going to run on phones, then you pool not only the technical infrastructure of Google and Apple and other cloud companies that help to deliver services, but you also pull in their political economy, which means that there is a whole number of companies that are lined up waiting for these apps to be launched. And once they have that, they're ready to say, we need all of these extra functionalities and expand what they do, which would allow them to, capture markets, capture population control, and therewith government tenders, et cetera. So those are some of the spaces that are maybe riskier and that are really difficult to foresee right now. And finally, with contact tracing apps, the models that are being proposed right now are based on Bluetooth. And it's important to distinguish between the calls for using location data and Bluetooth data. The location data is very problematic and is unnecessary for the task of improving contact tracing by capturing proximity, because location data is, first of all, product data. That's data that companies have used to deliver services. So it's constantly optimized for them to deliver whatever, like our phone services, or if Google is giving you maps, etc. So that means that when you start using location data for proximity tracing, you're conflating a health goal with the product goal of a company. So as soon as they optimize or change their data sets, you're changing also the quality of the health data, which is a very problematic and undesirable combination. We also know that GPS is not precise enough to allow for a precise measurement of proximity, which would deliver messages to those who were nearby and not to others because of miscalculations of GPS. And finally, as privacy engineers, one of the things we do is data minimization. And the way we do that is to say, what is exactly the task that you want to fulfill? And from contact tracing, we know we just need to know who was close to you. But we don't need to know when that was, and we don't need to know where that was. So let me qualify. We need to know, of course, if somebody comes in, so I went in, I'm infected, I tested positive, then I want to know who I was in touch with in the last 7 days, let's say, because my symptoms started 2-3 days ago, and and one is already potentially contagious in the 5 days before that. So I want to contact those people. So I need that 7-day window, or I need maybe times of days or like parts of the day, but I don't need to know the exact time stamp, like at 3:15. And finally, I don't need to know the location of where that encounter happened, whether it happened in the supermarket because I was in the queue with that person, or whether it happened because somebody sat next to me in a bus. All that information is unnecessary. All that the app needs to know is that I was close to somebody. So that means that location data is not neither, I mean, we said it's not good because it's product data. It's not good because it's not accurate, and it's also not necessary. However, we do see a lot of phone companies or people related to them or companies that work with them saying we need location data and let's track people for contact tracing, which is a false proposition. So I think the government is not a singular entity. So I think there are different parts, and there are different players in this field, and they are exposing some of these risks in different ways, and maybe in some ways they don't have the tools to capture all of them, partially because we are in an unknown. We're in an unknown in terms of we don't know if these apps will be successful. We're in an unknown as in we don't know if governments can take the necessary measures so that these tools will not be expanded in their scope of data collection and processing and will not be used for what we call mission creep. So, originally it was for contact tracing and, collecting information about people who were close to you, but now it can start to be used to enforcement, right? Like where you say, oh, you didn't stay home, look, I looked at your phone, and so now you're going to get a fine. That would be a complete breach of the purpose of this application. And then I think on top of all of that, there's the idea of how do you even tender this thing? How do you have a public discussion about whether we should introduce this new surveillance capability, hopefully constrained in time, but very likely to become an infrastructure that we will rely on again and again? How do you tender this thing, and how do you accommodate it, or how do you make sure that there's good oversight around it? I did see different approaches. For example, in Germany, there's a consortium that's saying that they have a proposal now working with Fraunhofer and Robert Koch Institute, and they have not been public with their proposal until very recently. And DP3T partially is still part of this consortium. They went public because PEP-PT was not being public about their design, and we're not allowing public discussion about both the details of the design and whether it should be deployed. In the Netherlands, we had the appathon, which was organized by the health ministry, which I would say was made with good intentions, but it was rather rushed. So it was trying to make something very public, but it used a method from, let's say, startups, technology makers, of hackathons, which are actually rather exploitative practices to get people to do, quick ideas for apps, which then can be maybe turned into a startup or invested in. And it's sometimes also used for hiring people. It's a way to scout talent. So it's a very exploitative and very industry-oriented approach, which I think was not appropriate given the seriousness of this application. At the same time, it's challenging, right? Like, because you want to have a diversity of ideas, and you don't want to just rely on experts because they maybe are too situated in a certain path, and it's interesting to get different ideas. But considering we might be implementing surveillance infrastructure, I think we need to give this thing time and thought. And I definitely think we need a sort of oversight organization that oversees this thing and makes sure that it's rolled out, used, maintained, and even at some point rolled back appropriately. You're asking me, what would make it safe? First of all, it's not just about privacy, because I think, there's great potential for this app to be misused. You can imagine it could be used to decide whether people should stay home or not. That would be a complete incursion into other fundamental rights, not just privacy. Let me just track back. Like, DP3T is making this app in a way so that there's no centralized authority that knows who is infected and who's at risk. So it's a notification mechanism that has a backend, but the backend does not know who is at risk or who is infected. There are other solutions that are being proposed that have a centralized entity so that they do know who is infected. However, all of these apps come, for example, with one weakness, which is that if I want to track people, I can just turn on my Bluetooth and get their data. And then I might not know who they are and exactly when they got infected, but if I could somehow be in their proximity, then I will also get a notification when they're infected, right? So now imagine I could put this phone in my kitchen. I'm a restaurant owner. I put it in the kitchen and I have all my workers going in and out of the kitchen, so that, and I know that most of the customers don't go in there. So if my phone then gets a notification, this phone is only in the kitchen, right? It gets a notification that I know that one of my workers has been infected, right? One could argue this is a great thing because, you know, now a restaurant owner knows if one of the employees is infected, but this can also be a terrible thing if people use this kind of information to fire people or to, you know, track people personally, or to, I don't know, go after neighborhoods where they think there are risky people living and say, look, more and more of them are now infected. And there's no way going around this because it's Bluetooth and Bluetooth-based contact tracing that we're introducing. And the Bluetooth is supposed to speak with every other device. That's exactly how the whole thing works. In DP3T, we have put some measures so that somebody cannot just follow you and find out if you were infected. But there's a limit to how much protection we can put, because the basic idea is that you broadcast to those around you your, let's say, little ephemeral IDs or breadcrumbs, let's call them, and all of those people who were close to you will receive a message if you're infected. There's nothing to do against that. That is exactly what this app is for. How will we ensure that people will be safe and that this kind of misuse doesn't happen? How will we ensure that if there is something like immunity passport, that this data is not from the application, from the contact tracing application, is tied to the immunity passport, which might impact people's mobility? How will we ensure that insurance companies don't all of a sudden ask for more money from people who have been seen as at risk multiple times, even though they tested negative, et cetera, right? Like, so there are lots of things that can happen, even if an app is extremely privacy preserving, like the one I told you, where there's no central authority that can follow who's been infected, but people can just demand the phones of people and say, that is your, so to say, basic ability to do things or enter spaces or work or get insurance, etc. So we need to have very strong oversight over this thing and very clear rules on how to protect people. So if something like that happens, they can go and complain and get their rights put back in place. It's interesting. I live in Belgium, so I work in Delft, but I live in Belgium, and Belgium is kind of going against apps right now. They're saying they don't want to take the risks that come with these apps. I believe in the Netherlands, the Ministry of Health has said that they will now make a dream team from those who participated in the appathon, partially because the appathon delivered 7 apps, but the Data Protection Agency and other experts said we cannot trust the designs because we don't have enough information about these designs. So the health ministry said now they're picking up on all these experts. However, I think, knowing from DP3T, the team there has, I would say, around 50 people by now. And that includes at least about 10 to 20 experts in anywhere from encryption, Bluetooth security, application and infrastructure security, like how to deal with Google and Apple, people who do software engineering and security. It takes a big team to get this thing right? Like, so you cannot just take a dream team from 7 startups or whatever they were. Some of them are, I think, consultancy companies like Capgemini, and all of a sudden scale them up to the equivalence of, you know, experts who have been working day and night for the last 5 weeks with all of this expertise. I'm not trying to say that experts know better, but I don't think you can get the privacy protections more right than what is being developed right now. And this does not even account for the complexity of making an app that is usable by health authorities. So that's practitioners, right? Like the nurses that are conducting tests can deal with patients and say, okay, now you've tested positive. Can you please use your app to inform your people who are in your proximity that you've been infected? That's, you know, that's a whole workflow. So we're changing the work of the contact tracing teams. We're requiring an infrastructure and a certain kind of logistics from testing to informing people. That needs to be put in place. We're hopefully talking about an oversight organization of some sort that will ensure that there's no abuse of this system, both in terms of mission creep, but also abuse of the system as it stands. There's a lot to do, and I hope that if we do that, that maybe there might be an app. What's really important, though, to go back to my first point, we should not suggest that the only way to go out of the lockdown is by installing an app, because I think it needs a much more concerted effort, and one that, whether it needs an app or not, is still to be tested.